The Federal Emergency Management Agency says it is limiting the amount of coronavirus prevention supplies that it provides to schools, election agencies, and local offices. That includes face masks, respirators, and sanitizers. This equipment will only be covered for reimbursement when it's used for an emergency response. The new restrictions will go into effect on September 15th. CBS News investigative reporter Graham Cates has been looking into this, and Graham joins us now. So, first of all, can you explain why FEMA was providing these supplies, and then why did they decide to stop?
Sure. Up until now and through September 15th, as you mentioned, these have been classified as emergency supplies. So if you're a school, if you're a local agency, and you have to buy a bunch of PPE, a bunch of sanitization products, you could apply for reimbursement from FEMA saying this was to deal with the national emergency so that my agency could operate. And now FEMA is saying these are going to be reclassified essentially as non-emergency. So if you're using PPE just so that you can remain open as a department and not to specifically target coronavirus cases, then you're probably not going to get reimbursed from FEMA.
But it's interesting, Graham, that they will only cover the cost of supplies in the case of an emergency. I think that there's probably some of our viewers who are scratching their heads wondering why a global pandemic does not qualify as an emergency. And where does FEMA now plan to divert these funds?
They haven't said exactly how they're moving their budget around for this or what kind of shortage they have that mandates that they do this. But we know what people are concerned about that might be happening. So the National Governors Association sent a letter to FEMA a couple of weeks ago because word came down that this kind of change was about to happen. And they said one thing we don't want to find out is that this is being done to satisfy this mandate from President Trump that FEMA chip in for jobless aid. They want to know that this has to do with the emergency department's budget for emergency supplies.
And to that other part of the question, why an ongoing global pandemic with schools reopening now for the first time for most of them since the beginning of the pandemic, why that doesn't qualify as an emergency? What's FEMA's response on that?
So again, if the school is operating in a way where they're just trying to stay open and the masks and the other supplies are just about being open in a normal way, except for the fact that people are wearing masks, that no longer counts as answering the emergency. However, let's say one kind of little bit of wiggle room that I talked to an emergency manager about was, what about school nurses who might be looking for coronavirus cases? And that's somewhere where they're still trying to figure out, well, maybe that might count, but maybe not. It's a lot of it is kind of they're waiting to see what FEMA says they will and won't do in real time. And so if the school, though, is just going through its day and the teachers need PPE and the students need PPE just to get through the day, that won't qualify as responding to the emergency.
So, as you know, Graham, parents, teachers, administrators, local officials, everybody's been trying to figure out this question of kids returning to in-person classes in schools. I imagine that FEMA's announcement now makes a big difference in that ongoing debate. Are schools going to be impacted by this in a way that might prevent them from actually being able to safely reopen or keep their doors open?
So there's two things to think about with this. The first is that agencies can stockpile up to 60 days under this new policy. So right now you could begin to try to make a mask stockpile or a sanitization supply stockpile of up to 60 days, and get reimbursement for that. But it's worth noting, flu season is right around the corner, and that's kind of the respiratory virus nightmare that we've a little bit been worried about, right? Because coronavirus is stressing some of those supplies, and flu season is going to stress some of those supplies. And so how this is going to be worked out with the schools as that develops remains to be seen. In one state, we saw a response already, which was that Florida set aside $30 million to help supplement what schools are spending on PPE. But that actually only works out to about $7,000 per school, which is, I think, fair to say it's going to be far short of what a lot of them have to spend on these supplies.
All right, Graham Cates, thank you.
Thank you.